All right, welcome everyone. My name is Jeff Donaldson. I'm convening this webinar series for the International Social Capital Association. The association's mission is to advance the research and application of... Welcome everyone. My name is Jeff Donaldson. I'm convening this webinar series for the International Social Capital Association. The association's mission is to... Sorry, there was a bit of an overlap on the time there. We'll just... In this session, we welcome Dr. Mohsin Malik from Swinburne University in Australia for a presentation titled Social Capital and Digital Transformation in Healthcare. Associate Professor Dr. Mohsin Malik has over 23 years of diverse experience in industry and academia. Before earning his PhD in Operations Management from the University of Western Australia in 2012, Dr. Malik worked as a professional engineer for 7 years. He joined Swinburne University in June of 2018. Before this, he served as an assistant professor at Abu Dhabi University from 2013 to 2016 and as a lecturer at the University of Melbourne from 2016 to 2018. Dr. Malik is currently a senior associate editor of the International Journal of Physical Distribution and Logistics Management, a member of the International Editorial Board, and a top-cited author for the International Journal of Project Management. We are delighted to great to have you at this webinar. Welcome, Mohsin, and over to you for the presentation.
Thank you very much, Jeff, and also your association that found my research interesting and invited me to present to your audience. But what I'll do now is, with your permission, Jeff, I've got a few slides which would serve as anchor point to our discussion, so I'll share that. It's okay to share my slides and talk through the...
Please go right ahead.
Yeah, good. Now, can you see the PowerPoint slides, is it?
Yes, we can.
See, okay, good, beautiful. So thanks, Jeff, for the introduction and the invitation to present my research. So I understand social capital could be conceptualized in many ways, and ours is an interesting one. It's the organizational social capital and how it can help the digital transformation in healthcare, which was my research. So I'll start with the problem. So research starts with the problem that we need to solve. So I came across this report from Boston Consulting Group. What it says is that it paints a very bleak picture of successful digital transformation. What you see on your screen, the 2020 and 2021 surveys, and there's not much of a difference between the 2 years. What it tells is that almost 65 companies, 2/3 of the companies that undertake digital transformation, formal digital transformations, they do not get the desired results. So that was, I read this report a few years ago, and that kickstarted my interest in solving the below expectations result for digital transformation. So that's industry report. And what they did was that they interviewed about 900 CEOs around the world, 900 company CEOs, or 900 companies, something like that. And so that's pretty bleak picture. So we had a real problem at our hand, and that got me thinking. Within this, what you see here is an industry, cross-industry report, comprising of all industrial sector. Within this one, what we saw was healthcare providers in particular were really struggling. Same survey revealed that the companies that belonged to the healthcare sector, only 16% were in the win zone. They were getting what they desired from the digital transformation outcome. So that told us that digital transformation is a trouble area. The industry is not getting what it wanted out of this initiative. Supposedly it should be, it promises a lot, but within the variety of industrial sectors, healthcare is in particular is greatly disadvantaged. What are the factors? We first started digging out those, and how can we solve this thing? So that started my research 4 years ago. Having given you the problem, there's a real world problem digital transformation, below expectation results, 2021, that was the area, the time period. And among all industrial sectors, healthcare was at a greater risk of not getting the benefits that they envisaged from healthcare. Okay, moving forward. Now, talking about the peculiarities of healthcare sector. So we know that we have got hard data now that healthcare digital transformation was struggling more than the other industrial sectors. And then we did some research and we realized that amongst other, because of high risk industrial sector, it's highly regulated. There are big data concerns with digital. There's big data and how the data could be used, and then how different digital systems can be connected. That makes this, healthcare a particular area of concern. And one thing we also realized that another peculiar thing about healthcare, which is different to other sectors, is that their workforce or their operations, they're doctors, they're specialists, they're nurses. Unlike other workforce, they've got a greater power and in terms of how they execute. And then at some point in time, in some occasions, that may not coincide with whatever the broader hospital administration or management is trying to do. So they've got the peculiarities of the workforce, the high risk settings, patient care, and then data privacy, among others. And even for smaller innovations, there are a bit of hierarchy that needs to be overcome that made the digital transformation healthcare particular is much more difficult than the other sector. And then focus on Australian healthcare sector. That's we started because we are here, and the author team was here. Most of the author team was here in Australia, but Australia is also an exemplar country. There are government initiatives as well, and there's a lot of focus on healthcare digitalization in Australia. So that we chose the context healthcare because we thought if we are able to understand how we can improve digital transformation outcomes in healthcare, that's more likely to be applicable across industrial sector because this sector is worse off. And secondly, Australian healthcare sector to us seemed a good exemplar sector where we could take out the idiosyncrasies of healthcare more effectively. So we chose Australian healthcare as the context, and then to investigate how we can improve digital transformation outcomes. So just giving you the background of the context that we have chosen for this research that I'm talking about today. Okay, now bit of background, and I intentionally put this here because the audience, I understand, would be diverse. So just to give you a background on whenever we're faced with a problem, like in this case, Boston Consulting Group, had some data to throw at the people and the audience. And normally what happens is that if you've got an industry problem, consultants like BCG would come and try to give technical advice. That will be their business, and they'll try to help companies. But digital transformation was somewhat different, because if, for example, somebody is doing a process improvement and some other Lean Six Sigma projects like these BCG consultants do and other consultants do for so many other businesses, try to improve the processes. For that, we have got an established body of knowledge. We know what needs to be done. That information, that knowledge has to apply to a context of a particular company. Engineers and consultants are very good at that, and they can solve that problem. However, so which I say now is that if we have that requisite knowledge that solves a problem, we just take that knowledge, apply to a new context, new firm, new organization, solve it. However, that may not be valid for digital transformation, especially 3-4 years ago. Why I say this one? Because this was a very new problem, right? A different problem, a unique problem. there was not much body of knowledge. So we took it as a research problem, try to understand. So the difference between research is that we create new knowledge, and then we apply it to a context to solve that problem. We can apply it to specific context like a consultant, or we can try to come up with a knowledge that could be broadly applicable across settings, and others could take it further to solve individual contextual business problems as well. So that was how we took it as a research problem. Our mission was to understand the complex mechanisms at play. Part of that was to understand what already has been done in this space. And once we understood what has been done in that space, we took that up and we took that and built our research design by utilizing what has been done and took it further to bring new insights that could solve the issue at hand. So again, I'm just trying to tell you what we call as theory, and I understand a lot of people have what we call is different interpretation of theory, but in essence, theory is simply new informed knowledge claim that has went through a rigorous process and that's applicable to solve a problem. Whereas practice solve, they address trees, they address specific issues, and theory is, a generalized informed knowledge that people could benefit. So broad picture. So what we were hoping to inform practice in this case is to come up with ideas that could solve a healthcare. So what we would found, we would be basing our insights on data from Australia because we need to have a context, but our best efforts were targeting that this information could be useful for all healthcare sectors. And then also, given the greater challenges with healthcare sector, we thought that if our theory or if our knowledge that we create can solve Australian healthcare sector, people should also benefit from it for other industrial sectors and in other countries as well. So that's forest versus tree, the overview and the broader picture that we were trying to create here. So I talk about that general structure, how things happen. So we are trying to create theory. We want to tell people that, okay, if we do this, this would be the likely outcome. That's the whole background. And practitioners, as I mentioned, they take and apply to specific context, specific organization, specific occurrence. But what we were trying to do was come up with a generalized body of knowledge. Now, part of that is to understand what has been done in this space. So we did extensive lit review, see what others have been doing. And what we realized that a lot of explanation of digital transformation comes from what we call as the dynamic capabilities view. Dynamic capabilities view essentially is described that, it says that companies or businesses have two sets of capabilities. One is called ordinary capabilities, and I was talking to Jeff here. Ordinary capabilities are related to our operations, things that we are doing all the time. Then there are external triggers, external stimuli that call for changing the ordinary capabilities, responding to an external event, environmental shocks, environmental triggers, or opportunities. But the ordinary capabilities are not designed to deal with that. What happens is then the firm needs to have another set of capabilities. They call it dynamic capabilities. Dynamic capabilities, as the name say, they transform the ordinary capabilities or existing resource base so that the external opportunities can be exploited or external threats could be averted. So because digital transformation is in response to external events, that's why dynamic capability has been the most common form of explanation. So we do take that into account. And so what dynamic capability does that, how do firms change their ordinary capabilities or their operations or their day-to-day activities is that first they need to sense what's happening outside the external signals, external issues that they want to leverage. what their competitors are doing, what are the industry trends. They sense those opportunities, then they need to seize those. And then when they seize, then seizing entails that they also need to transform what they were doing so that they can respond to external triggers. That's the dynamic capabilities theory in a short. And that is important because digital transformation is mostly explained in terms of, not always, but common way of explaining. And that makes sense because there are external triggers for digital transformation that needs to be taken into account. And in response, the way we do things in a firm, inside in an organization, we need to change how we're doing things. So that's dynamic capability. Okay. Missing piece that we found was how are those dynamic capabilities developed and orchestrated. So that was a missing chunk in our existing theory. And what we also found, and I didn't talk about that, I don't have a separate slide for that, but when I was reading, and I go back to the Boston Consulting Group report there, they not only they gave these stats of firms not meeting their digital transformation targets, they also dug into people's opinion, or leaders, so CEOs' opinion. Why do you think that digital transformations are not being successful? And most of the things that came from their report, they were inward looking. They said, leadership and other things. There's not much that was linking the internal operations to the outside world. So we noted that. Then we also noticed, so we know from the industry that most of the reflections on poor digital transformation results were based on the inward looking, see what we can do right within the boundaries of an organization or locus of control of an organization. And we also know from literature, it's dynamic capabilities within a firm. So there was a missing chunk, and that we thought that how are those dynamic capabilities? Is there an external link? And here is where we learned, we got to the concept of social capital, right? And then we started investigating. And so we do know that there is a stream of literature in management that talks about how network relationships help companies to overcome their limitations. Then there's the notion of mergers, acquisition. That's one sort of network relationships. But what we got attracted to was the notion of organizational social capital. So in our research, we realized that digital transformation is different because it requires what we call as non-generic external complementarities. You cannot do it on your own because it's new, very new. It requires certain capabilities. Some of those, at least, may not be present in your in the confines of your organization. You need to source it from elsewhere. We use the notion of complementarities. Yes, we got something inside, but we know external. If it's a generic complementarity, we could just buy it, right? We could just acquire it. We could just get somebody inside our organization. We could hire a new person, But the digital transformation requires the notion of non-generic, though something that cannot be bought off the shelf, that can only be developed over long term. You could source. It's a strategic sourcing thing. So we call that as non-generic external complementarity because of the gamut of social technical capabilities required for digital transformation, right? So those things took us to what we call a social capital. And we took a definition of what we call as the aggregate of resources embedded within and available through and derived from the network of relationship possessed by an organization. Again, it is what we call as organizational social capital. So then we realized, okay, fine. So digital transformation is, we started building something in our mind, a rough sketch. Yes, dynamic capabilities are essential to make digital transformation a success, but how do firms develop dynamic capabilities? For that, they need non-generic external complementarities, and that come from outside. and how to get it from outside to have a social capital, to have a network of resources where those non-generic external complementarities can be sourced from. So that was the overall mind map that we were developing. And so we call it, as now you also see here, non-generic, non-substitutable external complementarities. That's the key thing for digital transformation. And we know that because a lot of research has been done in that space. But what was missing here, how those are developed. And here we came, thanks to social capital, the notion of social capital, we linked it to the development of dynamic capability. So essentially, what our theorizing became was an integrated framing. So yes, dynamic capabilities are important, but the antecedent is the social capital or the network relationships, to put it simply. So so what our broad hypothesis became was firms leveraging social can source unique knowledge and resources for digital transformation. So that was our broad proposition, hypothesis, but then we had to be more specific, right? And in terms of being more specific, we now know, as I've told you, that social capital develops dynamic capabilities. And we have talked about that dynamic capabilities provide the mechanism to continually alter the ordinary capabilities of firms to cope with digital disruptions. So digital transformation are in response to digital disruptions that are external events, external signals, external stimuli. So when we were reviewing the literature, what are the dynamic capabilities? We realized now our focus now was, yes, we have identified that we need to source non-generic, non-substitutable external complementarities. Now, how that social capital, source is social capital, we know the social capital is the source or an antecedent mechanism. Now, what are the dynamic capabilities that are required to convert those non-generic, non-substitutable external complementarities to successful digital transformation outcomes? So we did extensive literature review. We identified three relevant dynamic capabilities. Number one is what we call as absorptive capacity. Number two is what we call as integration effort. And the third one is big data analytics capability. Now, we, as somebody not directly involved with research, you could think that big data analytics capability is a dynamic capability because a lot of information that exists in form of digital signals, organization continuously process that and use that information to change their internal processes. So big data analytics capability is essentially leveraging data-driven insights for transformation success in decision-making, in predictive modeling, and real-time monitoring. It's big these days. But there are other dynamic capabilities, spatially absorptive capacity. So getting external knowledge is one thing, and absorbing within its current resource space, current human resource is another thing. This is what we call as absorptive capacity. Without that, we would struggle in converting the non-generic, non-substitutable external complementarities to successful digital transformation outcomes. So that is essentially identifying, acquiring, and applying external digital knowledge. So absorptive capacity is the ability to acquire and apply external digital knowledge in to augment what we already know, right? What we already have, the ordinary capabilities, the existing knowledge base. So it's part of absorptive capacity comes, or a part of what we call as organization learning and innovation potential. So one, in addition to big data analytics, we identified absorptive capacity essential to convert social capital into digital transformation outcomes. Another one, what we noticed was integration effort. See, if you look at any organization, right, a decade ago, we have different departments, and then we'll have an IT department, which would be probably supporting those companies. Now, with digital technologies, the boundaries, it's digital phenomena in itself is what we call as boundary spanning phenomena. It's everywhere now. It's procurement is digital procurement. human resources digital, everything is now digital. So we just cannot cut off the digital. So integration effort is also important because now it has to cut through whatever we got from the social capital, has to cut through at all the functional, across all the functional areas. So with existing structures, strengthens collaboration across different functional areas. So then the digital transformation outcomes would be successful. So we identified absorptive capacity, integration effort, and big data analytics. So we have now roughly figured that in our mind, and we have got a mind map of connecting social capital to successful digital transformation through absorptive capacity, integration effort, and big data analytics. We've got that in our mind. Now we need to go further. We need to identify the specific pathways through which social capital may affect. Does it only affect through absorptive capacity, or does it affect in a sequential manner? These were the things that we had to come up with more detail. We had to define that with more precision. And that was, again, a lot of in light of what others had done, in light of the theoretical tools that we leverage, the social capital and the dynamic capabilities. Based on this, we came up with a figure like this. So it looks complicated, but it has a beautiful story to tell. So it's our model, it's our conceptual model. We haven't tested that as yet. What we found from all the things that I've talked through so far is that social capital, you see, that's this block here. Social capital would be affecting digital transformation outcomes, right? It may affect it directly. That's could be a possibility. But essentially, what we proposed was the mind map that I've been talking, how social capital may affect through a combination of dynamic capabilities, was now specified in terms of 4 hypotheses. The first hypothesis was external complementarities needs to be absorbed. That would lead to successful digital transformation outcomes. That was hypothesis 1. The second hypothesis was external complementarities would be integrated with the current knowledge base and would affect digital transformation outcomes. Third one was the external complementarities would result in big data analytics capabilities that would inform digital transformation. So the first 3 hypotheses suggested what we call as individual mediation or facilitation of the dynamic capabilities linking social capital to digital transformation. See, 1, first hypothesis, second hypothesis, and third hypothesis. So all those individual dynamic capabilities would translate social capital into successful digital transformation outcomes. That was one line of action that we took. Made sense in terms of the theoretical and the past literature. The fourth one was very interesting. While they may have individual effects, which we have conceptualized, which we think they may have, we also thought that they would also act in a successive or in a sequential manner. Social capital would affect absorptive capacity. Absorptive capacity would affect integration effort. Integration effort would also affect big data analytics. And big data analytics would affect digital transformation outcomes. So this whole discussion that we have had so far, in light of a real-world problem, in light of the theoretical grounding, in light of the past literature, we came up with these 4 hypotheses. After coming up with these 4 hypotheses, next was we need to test. So we've got this mechanism or sequence of mechanism or causal mechanisms. We wanted to check those, and for that, we needed to collect data. Because it's a positivist research, it's a survey-based research, we conducted a survey, we we contacted different healthcare providers, hospitals in general, and we sent them surveys, and they responded to the surveys. We were able to leverage some sophisticated statistical analysis packages, and we performed some analysis. Now, what I would tell you here, and I could go to the numbers, but because this is in front of you, so I'll briefly talk through the results. We did not find support that social capital would directly affect digital transformation outcomes, which we actually envisaged. All our hypotheses are suggesting pathways. So we found support for all four hypotheses. Like social capital would affect absorptive capacity, and absorptive capacity would affect digital transformation outcomes. We also found support for the second hypothesis, which is social capital would affect integration effort, and integration effort would affect digital transformation outcome. We also found support for social capital affecting big data analytics and affecting digital transformation outcomes. The fourth one, the sequential, social capital affecting absorptive capacity affecting integration effort affecting big data analytics, and big data analytics affect digital transformation outcomes. We found support for this one as well. So essentially, all four hypotheses were true, but the big caveat here is social capital had no direct relationship. So what it told us is having those non-generic complementarities, access to those doesn't mean anything. You need to have those dynamic capabilities. They will transform the social capital into the digital transformation outcomes. Now, I'll go further and talk through the results and some managerial implications, and then I'll conclude my presentation, then we can have a Q&A session after that. So it was a survey data analysis. So we've got all this, as I mentioned, all three dynamic capabilities did connect individual mediation or individual facilitation of connecting digital social capital to digital transformation outcomes. They also what we call as full serial mediation effect. Full serial mediation effect is the connection, successive connections of all the dynamic capabilities linking the social capital and digital transformation outcome. Now, this is statistics, right? But what these results tell, or what implications does this have for somebody working, let's say, a digital transformation chief digital transformation officer, or chief information officer, or somebody responsible for these transforming the processes and operations of a hospital or a firm in general, is that the whole arrangement that we've got, and I may go back to this one, right? So we know that social capital indirectly drives digital transformation. We've got this one. I'll go back and briefly talk about this one, the managerial implication that we were very pleased with. See, all organizations have limited constrained resources. Now, if we were to, for example, we now know that social capital drives digital transformation indirectly, not directly. We have found this support now. And there are different pathways. Each hypothesis corresponds to a pathway. Pathway 1, a pathway 2, a pathway 3. So if, as a first step, we've got constrained resources, we can focus on ensuring that how can we absorb the knowledge within our current knowledge base, whatever comes out, there are mechanisms that absorbs what we get. That's the first step. If we implement that, we can do it in a successive way. Once we do that, we'll get some results, some success with our digital transformation. Then we can, after this success, because of the constrained resources, then we can think of doing a boundary spanning of the digital technology and the new knowledge that's coming from outside across all functional areas. That would give us some extra benefits in terms of our digital transformation. And third one is big data analytics. So we can do that in a sequential way. We can start with big data analytics. It will give us some success. Then we can do others. Absorptive capacity, we can do integration effort. And when we do all of them together, we'll have the maximum effect that would drive digital transformation outcomes. So in terms of managers who are also balancing or doing a trade-off between the how much they can spend and the benefit that they can get. So it could be an incremental advantage in terms of how to leverage those dynamic capability. But the driving force is the social capital or the network relationships embedded in relationships. So I talk about this one, then we drive social capital is in fact develops those dynamic capabilities and orchestrates those dynamic capabilities, then contribute to digital transformation success. Okay, so and just to rephrase, we do here, strategic partnerships, as I mentioned earlier, as a way to inculcate or develop those external complementarities. Nowadays, there's a talk of business ecosystem view. Multiple firms work together in a business ecosystem. So what we found is one of the starting premise was that firms do not sufficiently look beyond their locus of control to store the requisite knowledge. Right, we found support for that one. We also found support that business ecosystem firms need to work together through the notion of what we call as external complementarities, and shifting focus from internal to a network, community within the business community is what we call as business ecosystem view. So those are the things that we have come up with. So these are key takeaways and managerial implications that link social capital to development of dynamic capabilities for successful digital transformation outcomes. So with that, I finish my presentation. Over to you, Jeff, and audience, if you've got any questions. Thank you.
All right. Thank you very much, Dr. Malik, for that. It's very interesting because while I wait for some questions to pop up in the chat, I just thought I'd open our conversation with often the difficulty we have in as you know, in the research world is when we find these relationships between the variables, operationalizing that for the community of practice. How do we translate that data foundation into something that the business leaders can often do, and giving them something practical to exhibit? Now, I'm often wondering whether you think there is more disruptions within this industry of being the healthcare. And I just come from the perspective of there's quite a number, as you've noted, of privacy concerns related to digital transformation and firms working together and creating a business ecosystem with the protection of privacy data. How do you think social capital helps us overcome what for most of us see is a realistic obstacle that should be there, is the protection of personal data?
Now, thanks, Jeff. There are two parts of your question. Number one is, how do we ensure that these results that we found, they're translated into some meaningful insights for practice that they can readily implement? That's number one. And then you talk about the specific context of healthcare. So I'll address both of them sequentially. That's absolutely, research. As in research, we say that a good theory is a very practical theory. It needs to have direct relevance to solving a problem. And as you know, that the starting point of this research was an industry problem. So it's more of a problem-led theorizing. Now, how do we ensure that people working with these problems in the industry get those information and sort this issue, and they learn from it? See, few years ago, we would just do research. Now, for the last probably a decade, any research that we do, the journals specifically require us to put a hat off from the manager's hat and explain in layman's language the managerial implications of the research. Now, that's part of a research paper. And then some of the managerial implications that I mentioned to you, simply, okay, we've done this great research, very thorough over many years, how somebody can benefit from it, who's sitting on a desk, engaged with the day-to-day challenges. So we have to come up with managerial implications. That's now structural arrangement and for the production of any research-based knowledge or paper. And that's one part of it. Now, there's more to it, right? Now, we need to get this translated into to the attention of many people. So my engaging with you here, presenting these findings, is another way of describing and reaching out the masses, right? And then there are other ways as well, which we could write a practitioner piece, right, published in a paper, published in the conversation, and other sorts of things. So now, having established the rigor and the findings, the next step is to spread the message, which is one of my intention to talk to you and your audience, is part of that. Now, going to the second question. Now, healthcare is very, very peculiar. As you mentioned, data concerns, also highly regulated, lives are at stake, right? A small mistake. So there's always tension between control and innovation, right? So in other sectors, the risk appetite could be greater. Like, for example, startups, like technology startups in general, they're driven by the innovation, so they can tolerate a lot more risk. Whereas healthcare, because of lives at stake and other concerns like data, especially the. So I remember a big criticism here in Australia of the electronic health record, which is part of digital transformation of healthcare, where every information is accessible to the different organization working on a patient, right? GP and others. So there was a big concern. And then in the end, the government gave a right to anybody who would want to opt out of this one. So their record without their permission would not be accessible to and to the practitioners, healthcare practitioners. So the big concerns, healthcare, as I mentioned, that's one of the reasons. Data privacy, highly regulated, big risk, less appetite for innovation. These are the factors that made digital transformation more challenging. And one thing that I mentioned, I'll again touch that here, is also how the workforce or the primary workforce, or like if it's to be implemented in a factory, let's say, right? So those working in a factory would have less power directly working the operations or the line staff, frontline staff, whereas the frontline staff or the touch point with patients is doctors, and they have got their own way of working. Some of them simply not embracing, not ready for the technology or the newness or the innovation, and they're too busy with others. So there are heaps of factors that are at play, which we now know. We have got evidence that digital transformation is much more challenging. The 16% versus the 35% that I showed you in the initial slides. So it's more challenging. But once the broader, remember, part of the research design that we had was to come up with generalized finding. Yes, every research has a context. We have to collect data, and that data comes from a context, right? We cannot collect data from all over the world because that would have its own challenges in terms of managing that. So what happens is that we try to use theory and try to pick a case which, if those data, the relationships hold, that could be applicable to other sectors. So our premise in this one is, if our notion of social capital influencing digital transformation capital through a digital transformation outcome through a series of dynamic capability hold in a much more challenging context like healthcare, that should be applicable to other settings as well. So the notion is the same. Network relationships, the non-generic, non-substitutable complementarities we have, if you have access to those, and you've got dynamic capabilities within your organization to convert those into digital transformation or to link social capital to digital transformation outcomes. If that can work in a challenging sector like healthcare, it's likely to work in other geographical settings and also other industrial settings. Thank you.
And that's a generalizability. And you're right. If something's going to work in something as important as healthcare, it's likely going to be generalizable across a lot of different industries. Sonia has a question. I'll give her a second to see if you would like to ask that question yourself, or whether you would like me to ask it for you. but I look forward to seeing where this go. I'm just going to let Sonia there popped up on the screen. I'm going to let you ask the question yourself.
Hi, everyone, and thanks for the presentation. As you were going through the presentation, it reminded me many years ago. Now, I was involved in some research that explored data roles, and I'm just wondering if you came across that in the work that you've done and looking at social capital between data roles or amongst the different types of data roles. If my memory serves me correct, there were 4 specific data roles that were sort of been identified in the research, and I'm just curious if you came across any of that in your work.
Thank you, Sonia. Thank you very much. A very good question, and very good question in a sense, because what I presented was the unit of analysis was organization. So organization dynamic capabilities, organization social capital. But as you very rightly mentioned, the data roles were more sort of the unit of analysis becomes individual working on those tasks. And social capital is organizational. It's also has different unit of analysis. And by extension or by implication, you need to have access. If you just, for a moment, if you change the unit of analysis to the broad idea is the same, you working as an individual or you working as an organization, you do not have the requisite knowledge for all the tasks that you need to do. In order to do those tasks, you need to consult or you need to have external complementarities. Those external, if you're an organization, would be from other organization. If you're an individual, such as the data roles, that would come from connecting to people who have those requisite skills. So I think the logic works over there as well. Because of my focus as an organization management, organization researcher, management mostly focused on unit of analysis, but the logic is absolutely applicable to the data roles, individual roles, and how they can do their job more effectively is to network, to get those external complementarities. Thank you very much. Good point.
Thank you.
And if anybody has any other questions, feel free. You can raise your hand if you prefer, with a little hand gesture, or place your question in the chat there. Another point that I think is important when we speak about the importance of social capital and the importance of building those networks and relationships, it often does not come down to a question of resources, a question of financial investment to build the network, but more of a question of time investment. And I think the research like yours very much reinforces the value of investing time in building these networks, in it translating to, as you say, managerial outcomes. But that kind of research is very important for that. And we do a lot of research here at ISCA and in my own world about the power of the relationships. Have you seen evidence where somebody or an industry or a group of industry has taken that initiative and built those networks and has seen tangible increased results as a result of following that one of those hypothesis pathways that you put forward? Have we seen tangible examples in practical applications that would demonstrate that efficacy?
Thanks, Jeff, and absolutely. So we're all converging on one point here is importance of social capital and those relationships. Now you're right, and that touches on Sonia's point as well. So again, unit of analysis, when we talk in terms of organization and we talk about if individuals, organizations have resources. Those resources could be in a number of ways. It could be time, it could be financial resources. But when it comes to the individual social capital and individuals building those network relationships, and for example, the data rules. So I think the balance, again, sometimes there would be some financial investment, but for individuals, the time investment, it's a resource, it's a scarce resource as well. We all nowadays, there's so many demands on us, and time becomes a very scarce resource. as is finances. So I see the same logic being applicable here, whether we spend financial resources or we invest time. Our time has a dollar value too. So good point, and much more applicable for the generating the individual social capital, where we primarily, yes, we can have financial resources being put in there as well, but probably more so towards time. Whereas and when we go to organization, yes, there's time effort as well, but time effort is again, but there's a form of dollar value in that as well. But when we're individual, we tend to put less dollar value into that, although there is a dollar value on that as well. So yeah, Jeff, good points. The logic is applicable. I haven't done that myself, but I don't see it being far away from what we are talking here tonight.
Perfect. Wonderful. Sonia, you have your hand up. Go ahead.
Yeah, another question, sort of as I'm thinking about your presentation, in the change management literature, Cotter talks about, like, there's 8 steps, and within one of those steps in the change management literature, when you're thinking about transformation for large scale projects, is forming a guiding coalition, or words to that effect. And as I'm hearing you speak and I'm thinking about social capital, did you, that forming a guiding coalition, like thinking about that and how that plays out in terms of social capital, the components of that coalition? I'm just wondering if that was sort of within any of your thinking during this work as well.
Thank you very much, Sonia. Again, we're converging into something, common strand here. See, social capital was something that was new to me when I first started researching this one. So dynamic capability, nobody's talking about how do we get those, get that external help, do external complementarities. Nobody is talking about that. Why is that? Then it took me to the foundational literature on social capital, something in a paper published in Academy of Management in 1994, Inksman and something, right? And they talk about this in the larger, in the language that was understood then. And in that era, for example, the big multinational companies would merge, would acquire other businesses. If you think, they're also, it's sort of one way of getting those external complementarities. Just buy them out, right? Just acquire them, or just merge with another firm, which is coalition is another level of network relationship. So there are different ways to get those complementarities when there were large multinationals, those acquisition mergers. They call also, business parks is as well, industrial business park is another way of that arrangement. Supply chain is another arrangement, right? Where it's more of a, product-based flow. More recent, so coalition is something which probably is somewhere in between merger, and it's more of a loose arrangement. The most common language at the moment, the contemporary view of, instead of acquiring, instead of getting those formal alliances is another one, right? Alliances and coalition. It's business ecosystem, which is getting really traction. It's what we call, there has been an evolution of the inter-organizational arrangement. Let's call those as inter-organizational arrangements, right? In order to generate value. It has evolved from formal relationships to supplier related, and now there's a value we have to now call it as innovation. There's a value proposition that we need to deliver, and for that, we've got a host of vertical and horizontal relationships together that would help us deliver that one. So coalition, yes, I think a more contemporary or more a new version of those relationships is what we can call business, which are less formal. They're easy entry, easy departures as well, much more, which is the digital space. Now we know that anyone can pick up a mic and become a news reporter, right? So the boundaries, the barriers to entry and leaving have because thanks to this digital revolution, digital transformation have reduced a great deal. And I think business ecosystem or digital platforms, especially when the value proposition has a digital component to it, it's a new version of coalitions, which I would say. So good point. Thank you, Sonia. Again, all relevant, but probably in light of the contemporary dynamics of organizational arrangements and organizational arrangements. Thanks.
I just thought I would add to that, taking that coalition to one step further, I've noticed that there are a number of industry organizational advocacy groups now taking together to bring forward the digital transformation in different industries. In other words, things like the Chemical Association of Canada or the Industrial Gas and Oil Association in the United States are getting together to bring that knowledge base together and leveraging social capital and relationships to collectively bring that knowledge together in online platforms where the membership is able to go seek and find that externality, those knowledge base that they don't naturally have. And I think it's a great marriage of your research into the networks and the presence of that social capital that says we don't have to necessarily own the knowledge, that if we share the knowledge, there's enough to sufficiently for all of us to be successful. So I think the implications of social capital here is that this is not a necessarily dog eat dog world where we need to buy our competitor out or we need to own the knowledge and keep it organic to ourselves. But I'm starting to see that in the different industries. In my field of disaster management and resilience, we see that where knowledge is beneficial to humanity. And while there is obviously some part of capitalistic nature of it, but the value to share it is greater. And I really think it's going to go forward. I'm going to just give one couple of more seconds there for anybody who has any final questions, if you want to put it in the chat. Otherwise, I'm going to hand it over to Mohsin there if you want to, Dr. Malik, offer a couple of closing thoughts, and then we'll close down the live stream. Don't see any more questions. Again, afterwards, if anybody has any questions related to this presentation or anything else related to the role of the International Social Capital Association, how you can join us, how you can join our free online network where we continue to have these discussions after the fact, the information is available there in the chat. I've put a couple of posts in there. Dr. Malik, do you have any closing thoughts or words for us before we depart for the day?
No, thank you all for the opportunity, Jeff and Trishan as well. I was very pleased to deliver this talk, and as I mentioned earlier, part of this engagement with the International Social Capital Association is to spread the message, the research that we've done. We would want this research to help people working in the industry. So I've explained my research, and if you've got any further query, you've got the email address as well. I think if you go to my website, university website, you should be able to get a free version of this research as well, which you could study and read. And if you've got any questions in that, please please reach out, and I'll be very happy to help. Thank you.
All right, perfect. Thank you, Dr. Malik, and thanks everyone for joining us today. This will be available on YouTube. It's live stream, but the recording will be available on the International Social Capital Association's YouTube channel, as well as information about it will be available on our website. Thank you very much, and have yourself a wonderful day.